This video is reviewing the musculature of the shoulder joint and the shoulder girdle. To start with, we need to remember that the muscles can only pull on the bones, they cannot push. So the muscles must be located on the side that the bone is moving towards. For example, when we talk about shoulder flexion, the muscles causing that have to be on the anterior side of the shoulder. If we're talking about elevation of the scapula would be moving up, so the muscles that cause that motion have to be located on the superior side of the scapula. So when we talk about those muscles, it's important to not only be able to identify them, but also know what they do based on where they're located. So reviewing the musculature located on the anterior side, starting with our biggest muscle here, we have our pectoralis major. And that muscle causes shoulder flexion and horizontal adduction. Moving to the outside, we have our deltoid, and we need to remember that that's split into three portions. So here we have our anterior deltoid, and then here we would have our middle section. The anterior portion causes flexion of the shoulder as well as internal rotation and horizontal adduction. The middle section causes abduction. And the posterior section, which we can't see here, would cause extension and external rotation and horizontal abduction. Looking to the other side, these are the muscles that would be deep to the superficial muscles that we see on the left. So here we see our pectoralis minor. Again, it attaches to ribs 3, 4, and 5 from the coracoid process, and it causes depression of the scapula as well as downward rotation and a little bit of protraction. Lateral to that, we have our coracobrachialis, which runs from that coracoid process to the humerus. It causes adduction of the shoulder, horizontal adduction of the shoulder, and flexion. On the top, we have the upper fibers of the trapezius. Those are the only fibers we can see from the anterior side, and they cause elevation of the scapula. Taking another look at the anterior side, on top we see the deltoid, which has been cut back to show the muscles underneath it, as well as our pectoralis major. Again, we see our pectoralis minor, and it attaches to ribs 3, 4, and 5. So it's only these fibers here, okay, that run up to the coracoid process. Underneath those other fibers that follow the same pattern, that's our serratus anterior. And that causes abduction or protraction of the scapula. The small muscle running from the first rib to the clavicle is our subclavius. And that muscle is there to stabilize the sternoclavicular joint, but also aids in depression and abduction or protraction of the scapula. The tendon that we show cut here would be the tendon of the infraspinatus, located on the posterior side that we will see with the posterior view of the shoulder. Looking at this view of the scapula, we can tell it's the posterior side because we can see the spine. So that's important to note when you're looking at the anatomy. Above the spine, on both images, we have the supraspinatus. Its primary purpose is to stabilize the humeral head in the glenoid fossa. If we look at its line of pull, it's applying some compression inwards on that humeral head, and it also causes some abduction of the shoulder. Over top of that, on this image, we can see the deltoid muscle again. Again, it's separated into middle and posterior fibers, and the separation is about right there. The middle fibers here cause abduction of the shoulder. The posterior fibers here cause extension of the shoulder, horizontal abduction, and external rotation. Underneath the deltoid, as well as on the posterior side, this muscle that is in the middle is our infraspinatus. It also aids in that compression of the humeral head in the glenoid fossa, again by pulling that humeral head into the fossa, as well as causing external rotation and aiding in a little bit of extension of the shoulder. Below the infraspinatus, shown here, as well as here, that we can barely see underneath the deltoid, we have our teres minor, which also assists with the stabilization of that humeral head, again by pulling it into the glenoid fossa and causing external rotation of the shoulder. Underneath the teres minor, we have the teres major, which causes internal rotation of the shoulder and a little bit of adduction. It can also assist with extension from the flexed position. The subscapularis is located on the anterior side of the scapula. So it sits between the scapula and the rib cage. As we can see again from its line of pull, it assists with that stabilization of the humeral head by pulling it into the glenoid fossa. It also causes protraction of the scapula and adduction of the shoulder, as well as a little bit of internal rotation. On top of that, we see the coracobrachialis, which we saw earlier, and it causes flexion of the shoulder, adduction of the shoulder, and horizontal adduction of the shoulder. On top, underneath the clavicle, we can see the supraspinatus. Again, assisting with that stabilization by pulling the humeral head into the glenoid fossa and causing a little bit of abduction. On the posterior side, again, it's important to remember that we have two layers of muscles. So looking at the superficial muscles first, we see the upper fibers of the trapezius, as well as our middle fibers and our lower fibers. The upper fibers cause elevation of the scapula, as well as extension of the head. The middle fibers cause elevation of the scapula, a little bit of upward rotation, and adduction or retraction, while the lower fibers, because they're pulling down in contrast to the rest, so they cause depression, as well as retraction and upward rotation. To the lateral side here, we can again see our posterior deltoid. And then deep to that, we can see our infraspinatus, as well as our teres major and our teres minor. Remember that infraspinatus and the teres minor are there to assist the humeral head in stabilization in the glenoid fossa, while the teres major causes upward rotation and protraction of the scapula. On the other side, we see the levator scapulae. Its job is to elevate the scapula. Below that, we see the rhomboid minor, which causes retraction, as well as upward rotation of the scapula and a little bit of elevation. Below that, we see rhomboid major, which causes downward rotation as well as retraction and a little bit of elevation of the scapula. Here we can also see the serratus anterior on the anterior side of the scapula, again, which causes protraction. It wraps around and attaches to the ribcage on the front. We can also see that on the opposite side. So here we see the musculature of the rotator cuff. So typically when we think of the rotator cuff, we think of internal and external rotation. Our primary purpose of the rotator cuff is actually to stabilize the humeral head in the glenoid fossa. So like we saw in previous slides, if we consider the line of pull of each of these muscles, it is pulling that humeral head into the glenoid fossa. And when we look at the collective work of those muscles, they really nicely secure that humeral head into the glenoid fossa, adding some stability. So again, that's our key purpose. The way to remember these muscles is to think of the acronym SITS. So we have our supraspinatus, our infraspinatus, teres minor, and then our subscapularis. Okay, these three are located on the posterior side, while this one is located on the anterior side. Again, their key purpose is to add stability to the glenohumeral joint.